In England, I think the biggest challenge at the moment is communication between different organisations. We've talked to customers who've got 1,000 separate data sharing agreements, even just for one fairly specific use case that they're working on. So trying to find a way to standardise that so that organisations can legitimately share data with each other to the benefit of the patients is a real challenge. I think there's two aspects to the challenge. The technical challenge is in coming up with standards that allow organisations to build systems that communicate to each other without having to do a lot of bespoke work each time. That is a big challenge, but it's a manageable challenge. It's something we understand. I think the information governance challenge, getting people to agree to allow their data to be shared, is the first step. Really showing the benefit to citizens, the population, of what they can get and how their health can be improved, their care can be improved by allowing their information to be shared, I think is the first step. But it's going to be a very, very long-term challenge. NHS Scotland is different in that it's organised into a smaller number of larger boards, so there aren't as many separate organisations. And some of the systems they have, they've managed to successfully follow what we'd call an opt-out consent policy, where data is shared by default unless the patient says otherwise. The other thing they've done successfully in Scotland is capturing patients' consent to share data, say at the GP's practice, so the GP data can then be shared with acute organisations, for example, and that consent's already been gathered. So really it's about how you get patient permission to share the data. What is important to the NHS is having standards that organisations can use to communicate with each other. FHIR is a new standard that has been designed specifically for these challenges. It solves the kinds of problems that the NHS needs to address, like how to transfer a patient's care from one organisation to another, how to get structured data from a GP system into, say, an acute hospital trust, for example. FHIR, in combination with the work NHS Digital are doing to design UK specific standards, is really an excellent way to solve that problem.